For the second video in our online anatomy series, we're going to look at injuries to the carpus. In a previous video we looked at the anatomy of the carpus. Now we will look at the most common injuries we see as equine veterinary surgeons in this area. So, just to recap, at full gallop or when a horse is jumping, a large amount of strain is placed on the knee and often there's hyper extension of the joint with the knee bending backwards. So, sometimes we get injuries to the front of this joint. Now, one of the most common site we see it is the distal radiocarpal bone. As you can see here, there's a fragment that's come away. It hasn't massively displaced, but you can see it on the edge there. There's this chip fracture. And this is one of the most common areas we see a chip fracture in the knee. Another site we sometimes see them is the distal radius. Now, interestingly, injuries to the distal radius or radiocarpal joint often don't present with as much soreness as injuries to the middle carpal joint will. So sometimes we'll see these chip fractures in pre-purchase examinations without any lameness seen. So it's just an interesting fact that we often see. Another most common site is the third carpal bone. The third carpal bone, as we explained in the previous video, takes a large amount of stress and pressure when the horse is at full gallop. Now, as you can see here, there's a slab fracture with the fracture line running in here across the front of the joint, and as a result there's a large fragment there. This is the best view we can see third carpal bone disease. Now, sometimes in severe cases we can also see it in other views. And this is another third carpal slab fracture, and you can see the fracture line running down here on one of our oblique views. So, how do we manage these? With chip fractures, the most common way and the best way is surgical removal of the fragment. The video you can see here has been kindly provided by Dr. Tom Russell of the Golden Valley Equine Hospital, and this is a chip fracture of a knee, one of the most common surgeries he would perform at Golden Valley Equine Hospital. With spurring and arthritis, often we manage that with changes in exercise level and also medical management. We will discuss this at a later date because medical management of arthritis could keep us here for several hours. So, thank you very much for watching this video. If you'd like to discuss a case with one of our veterinary surgeons, please give our office a ring or visit our website, and we look forward to seeing you again. Thank you very much.